Can we control the risk of cardiovascular disease in rheumatoid arthritis patients? Hello, this is Dr. Siddharth Damber, expert in rheumatology and in regenerative medicine. So in various studies, we know that the risk of cardiovascular disease if you have rheumatoid arthritis is 50 to 70% higher than what it is in the general population. This is so high, it's almost as much of a risk factor as diabetes is when it comes to heart attacks and strokes. In addition, the risk of actually dying from cardiovascular disease is 50% higher in rheumatoid arthritis patients, in particular for men who have RA. So it's incredibly important to find strategies to reduce the risk of cardiovascular disease in our patients with rheumatoid arthritis. Over the last 20 years, with dramatically improved treatments for RA in terms of improving inflammation in the joints, it's become clear that some of the medications that we use, whether it's methotrexate or the newer biologic agents, are able to reduce the risk of rheumatoid arthritis and heart disease and other types of cardiovascular disease. There's an interesting study that came out recently that looked at the effect of the biologic agents that we utilize in controlling rheumatoid arthritis joint disease and the effect on inflammation levels and on the effect of heart attacks, strokes, and other major adverse cardiovascular events. And what they found was that the biologic agents not only did a good job of controlling inflammation in the joints, they also did a good job of controlling inflammation in the blood, as well as reducing the rates of cardiovascular disease events. We know in this study and others that rheumatoid arthritis on its own is a significant risk factor for causing cardiovascular events. We also know that having higher levels of inflammation in the blood, including C-reactive protein, also correlates with higher rates of cardiovascular disease. So it's reassuring to know that the treatments that we're utilizing to control RA joint disease are likely also helping our patients to either diminish the risk or prevent the risk of cardiovascular disease long term as well. So then the next question is, how do we insert this effect on cardiovascular disease when it comes to deciding how we treat our patients? What we know is that our patients who are doing well long term with treatment will sometimes, either with their physician or on their own, start to reduce their medications that they're utilizing for controlling their RA. That makes sense because if you're feeling better, if you're not flaring up as often, perhaps you don't need as much medication. But there's another angle to inflammation, which is that if RA is increasing the risk of inflammation in the arteries, which then leads to heart attacks and strokes, then maybe we shouldn't just be tapering off medication if people still have that as a risk factor. And maybe we need to be looking at metabolic health, cardiometabolic health, cardiovascular health in our autoimmune patients, our RA patients, in a more proactive way and treating it more aggressively. For sure, it's standard that if you have a risk of future cardiovascular events that are higher because of an autoimmune condition, that you should be reducing any other variables that are associated with heart attack risk. That includes high blood pressure, cholesterol, diabetes, or any other metabolic health issues. But we should also be now thinking that we need to control overall inflammation longer term as well. And we need to be utilizing the best options when it comes to lifestyle changes for sure, in terms of exercise, diet, and supplements. But I think we need to also be thinking that with some of these newer meds that control inflammation so well, if they're able to reduce inflammation around the arteries, in the arteries as well long term, maybe we should be continuing patients on some of these meds, even when their joints are well controlled. It's a different way to think about how to treat rheumatoid arthritis, but it's probably an important one.